parked in Senator Gould's space.
I remember if Regina told me I could there, probably I just knew that she was in Kingman.
I don't know how many times I've sent
A lot of them
the
run
column
that license plate frame that says state legislator on it. I would never run that license plate frame, though.
No.
Just asking for trouble.
Exactly, slash tires.
You're just asking for trouble. Otherwise, the assistants have to park in the lot. It's like on the next block.
Yeah, keeping healthy. Exercise, right?
Give me just a second because I'm getting Supervisor Angus the call-in number.
Oh,
So she's not going to be present today?
If you want, the county wants to take over a road that has a, you have to ask ADOT for permission.
Okay. I sent it to her.
She on?
Toby Angus has joined the conference.
good morning, ladies and gentlemen. This is November the 23rd, special meeting of the Board of Supervisors. Thank you for all being here today. The Board of Supervisors will do a roll call at this time. We have a couple attending on the telephone.
Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Watson?
Here.
Supervisor Gould?
Here.
And Chairman Bishop.
I'm most definitely here. Okay, so the Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorneys on any item contained in this agenda pursuant to ARS 38-431-03, A3 and 4. So the official business to come before the board this morning, the first item will be a discussion on possible action. Ray approved the adoption of Board of Supervisors Resolution number 2020-166, approving the canvass of the November 3rd, 2020 general election. This was continued by the board at our November 16th, 2020 regular meeting. So, Supervisor Watson.
Thank you, Supervisor Bishop. I believe it was my motion to continue this item till today, and I'd like to make a motion to approve the adoption of Board Resolution 2020-166, approving the canvass for the November 3rd, 2020 election.
Okay.
Madam Chairman.
Supervisor Gould.
Yeah, I have grave concerns about the election in our own state and across the nation. I think it's really time that we take a good hard look at ballot security and our voting process, because I think that nationwide people have lost faith in this process because of this election. But my vote here today is not to canvass the election for the state, and it's not to canvass the election for the United States. It's to canvass the election for Mojave County. I don't see any disparities other than the normal errors. I do see some things that we need to tighten up, but I don't know. I'll be working with Ryan to find out whether we can tighten those processes up as a county or whether we have to do that through the state legislature. But there's a couple of things that I'd like to tighten up. But I'll be voting to yes to canvass the election today because I think that our guys did a good job and I didn't see any problems that were unusual problems in our county. So I second Supervisor Watson's motion.
Okay, we have a motion and a second.
Chair.
Any further discussion? Supervisor Johnson.
Thank you, Madam Chair. Is Mr. Kempert there? I'd like to ask him how many counties have not canvassed the election.
Supervisor Johnson, Alan Tempert is here, and he's happy to answer that for you. Good morning, Alan.
Good morning. Good morning, Chairman Bishop and Supervisor and Supervisor Johnson. As of at this moment, we're the only county that has not canvassed yet.
Thank you, Mr. Kemper.
Thank you.
Are there any other questions of Mr. Tempert? Hearing none, thank you very much, Alan. Any further discussion?
Madam Chairman, I just wanted to offer to buy Alan's lunch if he has to drive our numbers down to Phoenix today.
I believe he's probably going to be able to overnight them, so it was a nice thought, though.
I could still buy you lunch.
Okay, all those in favor, say aye.
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 Any opposed? Motion passes unanimously. Okay, the next and final item is discussion of possible action, Ray, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking any necessary action based upon the updates. County Manager Elters, did you want to start us off on this?
Yes, good morning, Madam Chair and board members. So additional to the regular COVID update that you will receive related to the numbers and the enforcement, we wanted to kick off the planning and preparation activities for the COVID vaccine and to inform you, the board, of the efforts underway to position for it. Given what we're hearing, the delicate nature of this vaccine, this will be a major undertaking. We want to approach it as a partnership between Mojave County Public Health Department and the medical providers community, including emergency responders, law enforcement, even public works for traffic, circulation and management, and the cities within the county. While we do not know exactly when the vaccine will arrive, we do anticipate it by the end of the year, and we want to be ready. So today will be a kickoff. We will update you, the board, regularly as the date of the vaccine delivery firms up, and let you know about our readiness and any challenges we're encountering. And so to that end, and with that in mind, I would ask Melissa to come up and provide the updates to you. Thank you.
Okay. Thank you, Sam. Good morning, Melissa.
Good morning, Madam Chair, Supervisors. As County Manager Elters already stated, we will start out with the numbers. As of November 20th, there have been a total of 5,346 COVID cases in the county to date. 4,187 of those cases have recovered, and there have been 233 deaths. Average age of a case is 47.7 years old, and average age of a death is 76 years old. Any questions on the numbers?
Are there any questions for Melissa on the numbers?
I have a question, Madam Chair.
Supervisor Johnson, go ahead.
Okay, thank you, Madam Chair. On the COVID fact sheet you send us, you have 40,000 COVID tests have been administered in Mojave County as of Friday. However, you only have a positivity rate of 7%. If you take the total confirmed cases we have and divide it by the total tests performed, we get a percentage positive of about 13%. Can you explain that?
Supervisor Johnson, at this time, I do not have a response for that question. I do know that that question came up, and I asked our data team to provide that information to me as to why the discrepancy between the 7% and 13%. However, I have not been back at my computer long enough to be able to see what the response was from the data team. I would be more than happy, though, to provide that information to the Board of Supervisors. And also, we will be responding to the question that was posed to us on Facebook from the public with that response also.
Thank you.
Any other questions? Okay,
On this or on anything else?
on this,
On the numbers still?
on the vaccines.
Oh, okay.
Supervisor Gould.
Thank you, Madam Chairman. Melissa, over the weekend, I was listening to a doctor from University of Arizona. I forget what her name is. She was some president of some national physicians group. They were talking about the 95% effectiveness of this vaccine, and how did they come up that it's 95% effective? Well, what this doctor told me was they had a trial of 40,000 individuals. Half of those took the vaccine, the other half got a placebo, and then they merely observed that 20,000 people, and about 5% of those folks ended up getting COVID. That's how they came up with their 95% effective rate. To me, that's somewhat troubling because that's not that much different than the rate of exposure in the general population. Is that how you understand that they come up with the effectiveness of a vaccine?
My understanding was that they provided them with the vaccine and the placebo and then exposed them to COVID-19 to see if then they contracted the illness.
She said they did not expose them because it was unethical.
I'm not aware of that particular bit of information, so that's something that I would have to look further into, Supervisor Gould.
Interesting. She also said that even after being vaccinated, if you are exposed to COVID, that you will be contagious if you actually get the virus in you, that you would then be contagious even though you'd been vaccinated.
That is correct. You would have to continue with what the current guidelines are, which is the staying isolated for is it 10 days? 10 days? Yes, thank you. 10 days, you would have to stay isolated. You couldn't be around anybody else. Taking into consideration whether or not other individuals had received the vaccine and how their body responded to the vaccine.
That seems odd to me because they're touting vaccine as the solution to the pandemic, but yet if people that are vaccinated are still going to be contagious, I don't see the point of the whole thing other than it keeps that individual sick, but it would not reduce the spread if that person was still contagious.
And Supervisor Gould, I believe it's still early in the game, so all of these types of questions have yet to be answered, and it's going to be something that we learn more about later on down the road.
Sure. The other thing was interesting. I know originally, I think the county health department disagreed with the closure of schools because children were not vectors of the virus, but yet now we've closed down schools. I'm wondering do we have a new opinion? Are children vectors of the virus?
I will ask my nursing manager to come up and to speak to the school-age children piece.
Thank you.
Good morning. So just to clarify, we, as the health department, haven't shut any of the schools down. The schools who have decided to either go to hybrid or to go to the online delivery of school, they came to that conclusion on their own. They felt that was best in their best interest.
Okay.
So,
Yeah, by we, I meant the community as general, not
Okay.
we as the county.
okay.
But thanks for pointing that out because there's people that watching that didn't know which we I used.
Yes, thank you. You know, we have had several cases within our schools. So I think it's safe to say that there can be spread among any individual, whether they're children or adults, if they're infected with the virus and proper precautions aren't taken. So to say that they're not vectors, I don't know that that would be exactly accurate. I can't speak to the exact numbers of how many cases are, or, you know, how easily children can spread it. I don't know that, but we have had several cases within the schools.
So we don't know, or we don't have the data to know whether children are catching this at school and bringing it home to their family?
We don't, not at this point, no. I mean, there might be, I don't know it off the top of my head, you know, how many in-depth studies are done at school and the spread at this point. I don't know that.
Sure, I just thought maybe we would have those numbers from our tracking.
Yeah, we have had them. Many of the cases within the school, the students who are infected are often because they've had a family member who was infected. So whether they've been spread in school, it's not clear all the time.
Okay.
As well, yeah.
So we don't know if we have any cases of children-to-children transmission, then bringing it home to their families.
I don't know it off the top of my head. I can look to see if we have any specific instances of that, but at this time, I'm not aware of any.
Okay, if you could let me know, that'd be great.
Sure.
Thank you. That's all, Madam Chairman.
Madam Chair?
Supervisor Angus?
Thank you. I've been getting calls. The calls I've been getting have been, you know, things like my husband was tested positive and never heard from the county. With the spike in cases, are you still doing contact tracing, or has it been kind of overwhelming?
Hi, this is Lynn Valentine again. And the answer to your question is yes, we have definitely had a spike in cases, and all of our investigators and our nurses have very heavy loads. But every case is being followed up with. You know, I don't know if the individuals who you're speaking to, I don't know if, you know, how long it's been since they've been diagnosed. Sometimes it takes several days for us to even receive the report of the positive case. But we are following up on all positive cases still.
There be an instance where you wouldn't know? I mean, this isn't just recently. I mean, all the way back, there have been instances of people who were never contacted by the county. I just want to be able to have an answer for people when they ask.
If it's a positive PCR test which is usually conducted via a nose swab or saliva, then we do follow up with them. You know, occasionally we have individuals who test positive with the antibody tests, and those are not considered confirmed cases, so those are not followed up with. But anytime that they are a PCR test, then we do follow up with them.
And if I call, can I refer them to the health department? I mean, that would be an anomaly, right? It's not something that you take a percentage of in contact. You're supposed to contact everybody.
That's correct. Yes, they can call us, and we do have individuals who do that occasionally, and we haven't received their report at that point or whatever the case may be, but we will look into it, definitely.
Okay, thank you very much.
Any other questions?
I've got another one.
Supervisor Gold?
Thank you, Madam Chairman. How do we administer a vaccine that has to be stored below zero?
Very carefully, yes. Very carefully is the correct answer. We're working through that, and I know the state health department is. I think health departments all across the country are working through that. At this point, if it is the ultra-cold vaccine, then it'll come in specialized containers that we use. But we do know that it's a very fragile vaccine, and there are very specific protocols to its handling and administering.
It would seem like that would give you would freeze this flesh when they tried to inject it into you.
No, it has to thaw out before.
Okay.
Yeah.
So that's the storage temperature, so that it's warmed up before it's injected.
Correct. Yes.
Okay. I thought I had another one. Oh, after somebody is vaccinated, there's no need for them to quarantine, is there? Okay, I was thinking about something that Melissa had said and thought it was an answer to a question that I might have asked improperly. Okay, that's all.
They won't quarantine.
Thank you.
Mm-hmm.
Ms. Valentine, I have a question. Some of my constituents are fearful that this will lead into mandatory vaccine by the government. Have you heard any chatter or hints that this may be going in that direction?
No.
Which, by the way, I would not support at all. But have you heard anything, or is that just Facebook chatter,
I think
drama,
so.
whatever you want to call it?
Nothing like that has been brought up, no.
Okay, thank you.
Madam Chairman.
Supervisor Gold.
I actually heard this morning that Ticketmaster is actually looking for you to be vaccinated before they will let you sell you tickets to a concert. So I believe that the way that they're going to force people to be vaccinated is not through physically holding them down and inoculating them. It'll be through the corpocracy, the corporations that run the United States will begin to disallow you the ability to go into their facility without being vaccinated. If people start requiring, like Ticketmaster's talking about, that you have some certificate of vaccination to attend one of their functions, then they'll sway you, they'll manipulate you into being vaccinated rather than forcibly hold you down and vaccinate you. Thank you.
Okay, any other questions?
Madam Chair,
Supervisor Angus.
did I miss like the timeline on this, when they're going to be available, and by what criteria will it be doled out?
Supervisor Angus, could you repeat that? You were very broken.
Oh, I'm sorry. Can you hear me better?
Hopefully.
Okay. If I missed it, I apologize. Did you give a timeline of when this is going to be available, and through what criteria will it be doled out?
Supervisor Angus, I have not yet gotten to that part of the presentation. That is later on in my presentation.
Oh, okay. I thought you were done. I apologize.
No, that's fine.
Okay, Ms. Valentine, you can continue.
Okay, so the next item is the hospital update. We continue to receive feedback from our hospitals within Mojave County that they are having difficulty obtaining medical personnel, especially the nurses. The department has provided this information to state, and we have been working with state to make sure that those needs are communicated down at the state level. And this morning in the hospital status report, again, we continue to track the ICU and bed usage, but as of today, we are seeing an increase in the ICU bed usage across all of Mojave County. We're seeing an increase in COVID patients and influenza activity. Any questions on the hospital status update?
Does anyone have any questions? Supervisor Gold?
No, I was turning it off.
Okay, no questions.
Okay. Public health staffing update. We started with 11 case investigators. As of Friday, we have 8 case investigators. We have 5 full-time and 3 part-time. We are currently doing interviews for data entry for the COVID response and for case investigators. Additionally, we will be having some of our public health temporary staff trained in COVID case investigations, so that way we have a team set for when things ramp up. And then our environmental health enforcement activities. We have had over 90 investigations resulting in over 160 inspections. As of today, we have 15 staff members who are working on those. Our COVID complaint investigations, as directed by the governor's executive order, are continuing, and we are grateful to the community and the businesses for working with us during this time. Any questions on that?
Anyone have any questions? I don't see any or hear any. Thank you.
Okay. Now I will get into the COVID vaccine portion of this presentation. The second week of October, Arizona Department of Health Services submitted a working draft of a statewide vaccination plan. This plan utilized the lessons learned from the H1N1 response and the 2019 Crimson Contagion exercise. This plan developed a distribution for vaccine across the state of Arizona. It includes a phased distribution, which in Phase 1A is healthcare personnel, Phase 1B, other essential workers and those at risk for severe COVID-19 illness, and Phase 2 are those at risk for acquiring or transmitting the disease and people with limited access to routine vaccination services. And the Table 2 within the vaccination plan, which I have put up on the camera. The vaccination plan that's still in draft form, that's available through Arizona Department of Health Services. This is the table that lays out the priority population. The priority population, they have an estimate for each number within Arizona, and it lists all of the types of individuals who would fall under each of those priorities. Any questions on priority population?
Could we get a copy of this?
Absolutely.
Any questions? Go ahead.
Currently, we could end up with one of two vaccines. Both of those vaccines require 2 injections, and those 2 injections need to be 21 to 28 days apart. Right now, we're looking at Pfizer, that's 21 days, and Moderna is 28 days. Distribution of the vaccine will involve a combination of healthcare providers, community partners, and public health. Public health and emergency management will be hosting joint meetings with community partners and leadership next week to discuss and plan for the distribution of the vaccine, and that will be for Kingman, Bullhead City, and Lake Havasu City. Public health has already met with Colorado City healthcare partners to discuss the distribution up in the Colorado City area. Once public health is notified to the date of the expected vaccine, which we're looking at possibly the end of December, as County Manager Elters stated in his introduction, we will notify the county manager, the Board of Supervisors, and the public that we have a date for that vaccine. And any more information that we get in the coming weeks, we will also provide that information to the county manager, the Board of Supervisors, and the public. Vaccine could be available through several entities depending on statewide partnerships and which healthcare partners have completed the vaccine onboarding process through the state. Public Health is currently planning for distribution via public point of distribution, also known as PODs, and this would be in partnership with community and healthcare partners. And I have a visual for these pods. And this is another item that I can send out with the prioritization list. This is an example of what 4 of our stations would look like. I've got a second page for our other stations. We're looking at a total of 5 stations, potentially 6 stations that we would need for each pod. So the first station would be the pre-screening and greeting station. We would have to pre-screen each of the individuals that came through the pod to make sure that they were an appropriate recipient of the vaccine. We are still working through the details as to what it would look like if one individual within a vehicle did not pass pre-screening. And we are also looking into the registration piece and if pre-registration would be available and what that would look like. Station 2, that is our registration, so the documentation would be obtained, any additional registration documentation, and then those who have their documentation filled out, there would be a fast track lane for those individuals. Station 3 would be the health screening, so that the nurses would review the health information and ensure that that particular individual is indeed ready for the vaccine. Station 4 would be the vaccination of the individual. They would receive the vaccine at that time. And then this would be Station 5. So post-vaccination, anybody who receives the vaccine must stay in a location to be observed for 15 minutes to ensure that there's no type of reaction or medical follow-up that would be needed post-vaccine. And then once they clear the 15 minutes, they are free to go, so they can exit the pod. Other areas that we're looking at first aid station, we're looking at a station for the staff to be able to get some food in between. Media area, a staff check in and check out, and then an incident command center. Looking at each of these stations, we're looking at about approximately 90 individuals that we will need per pod to make this happen for each community. And that is with 3 lanes running. So one thing that I failed to mention at the beginning, we are going to do drive-through. So everybody's going to be in their vehicle. They're going to pull into a location that we have been able to take over for a few days. They will drive in with their vehicle, check in, and do each of these stations within their vehicle. So we can do 3 lanes with 90 individuals. The more lanes we can do, the more people we can process.
Melissa, where are we going to find 450 employees to make this happen?
We will be doing at this time, and we're still in the planning stages, so it's not set in stone yet, but at this time we would be traveling to each city, so it'd be the same 90 individuals, or if we're getting supplemented through cities, help through the cities, help through the healthcare partners, it would be those city individuals, those healthcare partners for that particular city. So it would be the core group from public health, and we would travel to each city over, we're looking at possibly a couple months of doing this, because once we travel around, we administer the first dose, we're going to have to travel back around and do the second dose.
So if someone gets the first dose and for whatever reason they miss the second dose, do we follow up with that person and get them rescheduled for a following appointment, or are we tracking who comes back for that second dose?
That is an item that we're looking at in our pre-planning, and how we would, would we do a texting system? Would we do an email system? Would we do, how would we do those follow-ups? So that is something that we are looking at.
Okay.
We're just not sure yet.
Madam Chairman,
Supervisor Gold?
in the governor's press conference last week, they called that enhanced surveillance. It was actually, they were going to make sure you have to get the same brand of vaccine in the second injection also.
Exactly.
But they were calling it enhanced surveillance, which I thought was interesting. Thank you.
Any other questions?
Supervisor Gold?
Thank you, Madam Chairman. For screening, are we talking about medical screening where they're actually going to take a look in the people's throats and in their ears and make sure that they don't have an underlying infection?
It's going to be temperatures and asking if they're experiencing any COVID-like symptoms. So it would be similar to when you go to your physician and they have the COVID questions, and then you take your temperature before they have you go back to the office.
So we're going to be inoculating children in this program also, or?
This is adults only at this time.
Adults only? Okay. Thank you.
Any other questions?
Okay. As this is a fluid situation, we appreciate the support and flexibility as we do not yet know all the details, including which vaccine will be provided at this time. So that is the end of the vaccine presentation. I do have some graphs that I pulled on Friday just to provide a visual of what we're seeing for cases. So this is our business benchmark. This is for Mojave County. Back in, I believe it was August, September, we were looking at almost reaching the minimal range. And we are, again, a bit of a ways out from reaching that minimal. We're solidly in the moderate and continuing to increase in cases. And then the last item is our epi curve. So this is Mojave County cases, and this is the trend that we are currently seeing. Any questions on either of these two items?
Madam Chairman.
Supervisor Gould?
So the previous slide is based on percent positivity of testing,
That is correct.
and the second one was on the number of cases.
That is correct.
Thank you.
Any other questions?
Madam Chair,
Go ahead.
the health department, along with local municipalities, was given the authority by the governor to approve any events over group of 50. With the rising number of cases, are we still approving special events for the group over 50? And if so, can the board be advised when any permits are given?
Supervisor Johnson, I believe what you were asking about was groups of more than 50 or events with more than 50 individuals participating?
Yes.
At this time, for public health and not including environmental health, I will have to ask our environmental health manager, Ron Balsamo, to come up and speak to the environmental health portion. However, each city is the entity that would be providing the permit to have those events. There have been cases where event holders have provided their documentation of how they will plan on enforcing the CDC and the ADHS guidelines within their particular event. We do not approve it. We review it and ensure that it has the important parts of the CDC and the ADHS guidelines in there, that they do have a solid plan on how to follow that. And then we let them know that it has been reviewed. We do not approve it. And then they take those plans to the city, and it's up to each of the cities to then provide a permit for that event.
It's my understanding that you were given the authority, along with cities, to approve these in the unincorporated area. That is not true?
For unincorporated areas,
Yes, ma'am.
we do not have the authority. No, we do not have the authority. I'm told by the manager of environmental health we do not have that authority.
Chairman Bishop, if I may interject here.
Yes, Mr. Esplin, please do.
I think what Supervisor Johnson is getting at, in the executive order, it specifically said no groups of 50 or greater, and that it would be the cities that would monitor that in the cities, but then in the unincorporated areas, it'd be Mojave County would be allowed, would have, excuse me, in the unincorporated areas, the counties would have the authority to do that as well. So they would have to come and get approval from the Board of Supervisors or who you designate to give that authority to. You may recall that discussion probably, 3 months ago. I think it was in July is when we had that discussion. And it's the same thing. What we discussed back in July is the same today. If there's a group of 50 or over, they would need to have authorization from the county in order to have the group, unless they fall within one of those exempt categories. There was a number of exempt categories of things that are constitutionally protected, First Amendment things like political rallies, Churches are also exempt under the First Amendment. A couple of other things that were exempt, but otherwise, the same is true as what was discussed back in July. And I'll just kind of remind the board, I don't think that there was ever really a set, firm resolution to how groups should come to the county. They could come to the supervisors, or you could authorize, or you can give the authorization to the public health department, to the environmental health. You could do that whatever you wish, but the governor's order is still in effect.
Okay.
So.
Supervisor Johnson, did you want to make a motion and give this authority to a department?
Thank you, Madam Chair. I would make a motion to give the authority to the County Health Department to do the approval of any gatherings or events of groups over 50 and to report back to the board what to do.
Okay, we have a motion on the floor. Any discussion, or is there a second?
And if I could just clarify, the way that I understand the way Supervisor Johnson, if you envision this, it would be if there's a group of 50 or more, what they would do is they would contact the public health department, and the public health department would say, okay, what is your plan? Look at your plan, evaluate the plan to determine if it complies with CDC guidelines. And if it complies, then the public health department would say, okay, that works. If the department says, no, that does not work, we don't approve it, then they would not have authorization to go forward. At least that's my understanding of how it would work.
Okay, that brings up another question. If an event is planned and they're planning it for 49 people and then 100 show up after the fact, it's too late to do anything at that point. So it's
You're right. I mean, you're relying upon the person to be truthful, and there's going to be mistakes made, honest mistakes, and there's going to be some people who will intentionally get around the rules. I mean, you're going to have that in any situation. But in terms of trying to monitor this or whatnot, I mean, the law is still there. I mean, the governor's order is still in effect.
okay.
Madam Chair?
Supervisor Angus, go ahead.
So what would happen if a group gets together, they didn't know or just didn't call the health department? Who enforces it? I mean, the health department has the authority to go and say, break it up. Are we going to really start doing that?
I don't think that we would. I don't know. That's a good question. I don't know the answer to that. I mean, that's part of the challenges with the executive orders is, you know, the governor will issue an executive order, and then we're left to scramble to try to figure out how to enforce it and whatnot. And as you can see, we've been working with that for the last 9 months, and it's a challenge. It has been a challenge for both public health, for our office, for law enforcement, to really know and understand how to do it. I don't know the answer to that. How it would work if somebody said, you know what? So basically, it's after the fact. We learn about it after the fact. I don't know.
Yeah, I think it's a bad idea going down this road again. People know that if they're in a large group, that there's going to be some risk, and by being there, they have consented. I think that to put it back into the health department, our already overburdened health department, who have to go and basically play bad guy in businesses and stuff, I think this is a really terrible idea.
Supervisor Gold.
Thank you, Madam Chairman. So currently, Ryan, that authority rests with the Board of Supervisors?
Well, it just says the county, right?
Okay.
I mean, so I assume that it would be the Board of Supervisors. I'm trying to pull up the executive order right now. Okay, so it's effective June 29, 2020, organized public events of more than 50 people. So it's public events. If it's a private event, that's not what we're talking about. It's organized public events of more than 50 people are prohibited unless the city, town, or county in unincorporated areas has approved the event, and only if adequate safety precautions are implemented, including physical distancing measures. A city, town, or county in unincorporated areas may deny a request for an organized event due to public health concerns related to COVID-19. Any approval may be subject to certain conditions or restrictions not inconsistent with this executive order. Nothing in this order shall inhibit a person from engaging in constitutionally protected activities such as speech and religion and any legal or court process provided that such is conducted in a manner that provides for appropriate physical distancing. So it doesn't specify the board, but I would assume it would be the board.
Okay.
Because
And I remember the discussion between what was a private event and what's a public event. Was a public event is when we were offering tickets for sale. Is that a private event?
I wouldn't necessarily that. I would say I have a hard time putting my words on it, but I would say if it's by invitation only, it's going to be private. If it's public, we're say anybody can come. Ron Gold can come, or Ryan Esplin can come, or anyone else can come. I think that would be public, whether that's free or if it's a ticket or not. I mean, if you say, hey, anybody can come here, open to the public, I think that's a public event. There may be other criteria here. I'm just kind of shooting from the hip.
Yeah, I remember the whole discussion is problematic. So currently, in our policy currently is?
We didn't come up with a
Policy.
policy. We didn't come up with one.
Okay. And the governor can always send the Department of Public Safety to enforce his rules if he so chose.
You could. I mean, there's, I'm looking at it's law enforcement. This executive order allows law enforcement and any regulatory agency to take immediate enforcement action. This says against any business that fails to follow this executive order. So
it's a may, not a shall?
Correct.
Okay.
Yeah.
So it doesn't say that we shall enforce it?
No, it's to the discretion of the particular jurisdiction.
Thank you.
Any other comments? We do have a motion on the floor. Is there a second? Okay, Supervisor Johnson, I'm not hearing a second on the motion.
Thank you, Madam Chair.
Supervisor Watson.
Thank you, Chairman Bishop. In relation to the 50 number, I had the opportunity to kind of monitor many of the organizations and functions in the vicinity of the Kingman area. And it appears that those folks that want to cooperate put together a plan with our health department and go through a planning process for the protection of those folks. And other occasions and events simply ignore those suggestions and have their event anyway. So with a lack of authority or a lack of enforcement to pursue that, I'll be voting against the motion.
Okay, thank you. And I agree. We have no way to enforce that motion. So it kind of just be a policy that we were not able to enforce. And I think you're right, Supervisor Watson. I think most people want to do the right thing, and they do limit their gatherings. So I guess for now, we follow the governor's executive orders as is written. If there's a group that wants to have an event, they would bring that to their district supervisor and would bring it up in front of the board for approval. Correct, Mr. Esplin?
I don't know the answer to that. There's nothing in the executive order that specifies how the process will be done. There's not. What I was suggesting, and I think what Supervisor Johnson was suggesting, is that we have a procedure, and he presented the procedure, and the board chose not to adopt that. So you may want to find a different procedure to do that, but otherwise, right now, I think you're going to probably have a different way that it's going to go about it. The order doesn't specify how that'll be done.
So we would need another motion more specific to bringing it back to this board for approval, or
If that's what
just
you
leave
wish.
it as it is.
Correct.
Okay.
Correct.
Okay. So I hear no one jumping for the microphone to make a a different motion, so I guess we'll leave things the way they are right now with the governor's executive order. Okay. Do you have anything else, Melissa?
I do not have anything else today.
Okay. Anyone else have anything to discuss under this item? If not, I'll,
Madam Chair,
Supervisor Angus, go ahead.
real quick, now that cases have spiked, does the board wish to resume reporting on the weekends? I haven't seen the press release or how many, because, correct me if I'm wrong, the number that comes out today will be like Friday afternoon, Saturday, Sunday, and Monday morning. So I assume that's going to be a pretty big number, and if not given context, it could be a little confusing. I, at the very least, want the PIO to, give the time period this is from. But I believe we stopped reporting on the weekend because we were down to 0, but now we've spiked again. Just a suggestion.
Supervisor Angus, you were difficult to understand, but I think you're asking for reporting to be done every day like we did in the past. Is that what you're suggesting?
Yes, over the weekend. So to give context to maybe a very large number on Monday.
Did you want to put that in the form of a motion?
Sure. I make a motion that we resume reporting 7 days a week.
Supervisor Gold?
Thank you, Madam Chairman. Are they doing tests over the weekend, and are the lab working over the weekend?
I am not sure. Yes. Our nursing manager shook her head yes.
Okay. But I would assume that the public information officer can put note that the Monday number includes Saturday or tests run over the weekend. Thank you.
Mm-hmm.
Madam Chair, I did get some calls from people who really do watch this on a daily basis, and for whatever reason, and preferred. It was more than one, frankly. So I just thought if it was the board's wish, but at the very least, make sure that we designate that the number on Monday is for a much longer period of time.
Madam Chairman.
Mr. Elsters?
Madam Chairman, Supervisor Angus, we will definitely explain that in a note. My recollection is with the board approval, when we went from reporting every single day through the weekend to reporting Friday and Monday, we did announce that, we did explain it, but your point is well taken, and I assure you we will do both. We will explain today that the numbers are inclusive of the weekend, and on Fridays we will also remind everyone that we would not be reporting over the weekend until the board directs us otherwise.
Okay, maybe Roger can clear this up for us. So, Roger, when you do your news release, can you report the numbers individually and then collectively? Like you report Saturday numbers plus Sunday's numbers equals the numbers you're reporting on Monday, so that people know what the increases are over the weekend?
Well, right now, our latest figures come from Friday. And when we do the press release today, it will be reflective of mentioning that the figures today would include after Friday afternoon up to today. So it would be over that period of time.
So I think what Supervisor Angus is requesting, based on information received from her constituents and also mine, is that They want to know exact numbers for each day, not a collective amount.
That would have to come from the health department, not from me. I mean, am I correct, Melissa? Would it be broken down that way?
It would be from us. I would have to check with the data team on how we can break those out to ensure that the Saturday numbers are separated from Sunday. You have to talk in the microphone or they can hear you on the phone. I would have to check with the data team to ensure that we can break those numbers out between Saturday and Sunday numbers and minus the Monday numbers.
Okay, could you bring that back to us at the next meeting?
Absolutely.
Okay, Supervisor Angus, would you be okay with that?
Sure.
Okay, so I'm assuming you'll withdraw your motion.
Yes, I withdraw my motion.
Any other discussion before we adjourn? Okay, this meeting's adjourned. Thank you.
Hildy Angus.
Has left the conference.
Supervisor